In this module, we'll look more closely at the patient report that's generated for a patient you've assessed for periodontal disease risk and severity, discuss how you can use these reports to communicate more effectively to your patients, and what the information on the reports means. When you've transmitted the data needed to calculate PreViser scores, you'll see the View Reports screen. Just single-click on the View Patient-Friendly Report, and the report will launch in a browser window. Starting at the top left, the practice information that you entered on the Options page of PreViser is shown. To the right, the patient information is indicated. It's important to remember that this report is completely individualized to the patient, and the clinical and historic information on the patient you entered has been used to produce the scores and the recommendations. Note that the patient has a PreViser ID number. This very long number is HIPAA compliant and is how the patient is identified on PreViser's computers, not the patient file stored on your computer, which is organized by name, but on the master database that contains all records of all patients assessed anywhere in the world by PreViser. These are stored in disidentified form, and that's why they're HIPAA compliant. In fact, if a patient is referred to an orthodontist, a periodontist, or another specialist who has access to PreViser, entering this long disidentified number into the application when creating the patient record at the specialist's office will recall all prior assessments, but not the name, since that's not present in the PreViser database. The first score shown is the PreViser risk score. The best way to think of this score is that it's a prediction of the likelihood that the patient's periodontal status will worsen absent appropriate and active intervention. This is a very important qualification to the meaning of the risk score. If the patient accepts your care, then the adverse outcome that's associated with elevated risk can be largely nullified. PreViser has published research showing the relationship between the risk score and tooth loss, the endpoint for periodontal disease, when the patient does not receive appropriate therapy. Let's take a moment to look at that data. This was first published in JADA in 2002 and examines the percentage of dentition lost due to periodontal complications at different PreViser risk levels when no specific periodontal therapy is provided to a patient. What's important to remember about the over 500 patients in this study is that they received routine dental care, just no perio services. For a PreViser risk score of 2 or low risk at base year 1, 3% of the total dentition was lost due to periodontal complications over the next 15 years. For high risk, 23% of teeth were lost. This graph can be very useful in helping patients understand the importance of your services, and you can get a copy for your practice in the download section of PreViser University.